Good evening and hello. My name is Renee D. Waring, and I am the founder of Uniquely and Wonderfully Made Ministries. I'm glad that you joined us today. Welcome the new members of our community. Today I will be presenting part two of the topic Police and the Mentally Ill. Last week I discussed the testimony of Corey Kohemer, who testified on Thursday, August the 13th, 2020, before the House of Representatives of Pennsylvania. She was the Mental Health Program Specialist Coordinator of the Crisis Intervention Team of Franklin County in Bolton, PA. Her organization was founded in 2013. Quote, Crisis Intervention Teams, otherwise known as CITs, develops programs to train police officers which guides them in their interactions with those living with mental illness. Training helps bring about better outcomes when police officers encounter persons who are mentally ill. And this is unquote for Wikipedia. In addition, CITs are called by the police when they encounter a person with mental illness who needs to get treatment. In 2017, the CIT of Franklin County was given a 2-year grant to develop a pilot program co-responder model. The group did so well that another grant was given to develop a second co-responder group. The mental health program of Franklin County lasted 4 to 5 years. During that time period, 800 people received services and 91% of them had no further contact with police. This week, I will discuss the testimony of Nikki Dawson, who is the Advocacy Director of the State of Pennsylvania Division of the National Alliance of Mental Illness, otherwise known as NAMNI. NAMNI is the largest grassroots mental health organization in the USA. It is dedicated to improve the lives of millions of members affected by mental illness. There are 31 affiliates in Pennsylvania with over 1,000 members who receive support, education, and advocacy. The members of NAMNI comprise of primarily people who with mental illness, their family members, professional health, mental health professionals, and advocates. As a grassroots mental health advocacy organization, they know the realities of stigma, prejudice, and discrimination against people who have mental health conditions. All should be treated with dignity and respect. They also should deserve excellent, quality, and affordable health care. For too long, law enforcement has mistreated people who are experiencing the symptoms of mental illness, which leads to devastating outcomes. Law enforcement is ill equipped to properly handle these emergencies. That is why NAMNI has long supported CIT as a model which inspires communities and law enforcement to help crisis responses safer, help make them safer, more compassionate, and focused on connecting people to care. In the late 1980s, there was a tragic killing of a young man in Tennessee by police. As a result, the community and Anomni affiliates sought out to develop a community response that was more intelligent, understandable, and most importantly, safer method to use when police encounters a person who has mental illness. In 1988, NAMNI used seed money to develop CITs in Pennsylvania. Currently, there are 35 CIT organizations in the state. Amongst the CRTs in Northeast PA, amongst them are CITs in Northeast PA, as well as Susquehanna, Wyoming, and Wayne counties. The programs have saved police departments, hospitals, and other community institutions millions upon millions of dollars. Therefore, mental health intervention programs are cost effective for the communities they serve. In 2019, a community in Northeast PA had a total of 24,000 calls made to 911. Out of that number of calls, police were requested only 250 times. CIT programs are being developed in San Francisco, California, Albuquerque, New Mexico, Indianapolis, Indiana, New York, New York, and Atlanta, Georgia. Many African Americans with mental illness are still dying at the hands of law enforcement. Unarmed African Americans with mental illness are killed at a rate 5 times that of their unarmed white counterparts. The national call for racial justice has exposed the numerous deadly encounters between law enforcement and people who are mentally ill. NAMNE believes that we must focus on several areas of community mental health. One, there must be a comprehensive and culturally competent crisis care. Two, inpatient care and outpatient care options must be very accessible to those who need it. Three, we must invest in support and services that help people to stay well. And finally, four, we must have comprehensive care based on well informed principles that are available to everyone. Thus ends my presentation for today. I trust that you found the information both interesting and educational. My next video will air on the fourth Friday of this month. Tell somebody about the video and about our community and ask them to join free of charge. Subscription form can be found on the profile page of my Facebook account. Put in Renee, Renee Warring, Warring, into the search engine and click on the word sign up, which is under my professional photograph. Thank you for being members of my community. It was my pleasure making this presentation to you today. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Warring, and I am the Warrior Warring.